So let's take a look first at what value-based care is like with respect to hospitals and CMS. Approximately 3,000 hospitals across the country are affected by the Inpatient Prospective Payment Systems, IPPS, which started in 2012. Each year, CMS has issued proposed rules with comment period and then finalized the rules for the following year, which starts each October. Hospital payment adjustments are applied to the base operating MSDRG payment amount for each discharge occurring in the applicable fiscal year on a per claim basis. CMS distributes funding adjustments based on a hospital's scores in comparison to all other hospitals and funds available. This could result in a net change in payments of up to 2% increase or decrease. The IPPS program was designed to improve quality, efficiency, and safety of care for Medicare beneficiaries in acute care settings, as well as improve their experience of care during hospitalization by several possible factors: eliminating or reducing occurrence of adverse events, adopting evidence-based care standards resulting in better outcomes for the greatest number of patients, re-engineering hospital processes to improve patient experience of care, increasing transparency of care quality for consumers, clinicians, and others, and recognizing hospitals that are involved in provision of high-quality care at a lower cost to Medicare. So let's look at 2019 for hospitals. The CMS Value-Based Purchasing Program, as they call this program, is based on performance as measured in one of two ways: achievement on measures compared to other hospitals' performance during a baseline period, or improvement in performance on measures compared to their performance during a baseline period. Performance is based on measures and dimensions grouped into quality domains, which are assigned weights to achieve what is called a total performance score, or TPS. Measures and weights change over time. For 2019, the domains and their measures and weights include clinical care domain with 3 mortality and 1 surgical complication measure. This represents 25% of the total performance score, TPS. Second, person and community engagement domain, which includes 8 dimensions of the age caps. That is another 25% of TPS. The safety domain, which is 5 healthcare-associated infection and 1 perinatal care measure, also 25% of TPS. Efficiency and cost reduction domain, which is 1 Medicare spending measure, and this rounds out the last 25% of TPS. There may be some reweighting if a hospital receives scores in at least 3 but not all 4 of the domains. It is noted that earlier, clinical care accounted for 30%, with outcomes measures at 25% and process measures at 5%, with safety then lower at 20%. Projections through 2021 appear to stabilize the weights as they are proposed for 2019, equally a quarter each.